Care Services, because there's no place like home.
Good morning and happy South Florida Saturday. Mike McGann here with you as I always am, and this is Limitless Health Horizons, brought to you by Horizon Care Services. You can learn more about Horizon Care Services by checking out the website, and it's pretty much right there, horizoncareservices.com, horizoncareservices.com. You can also call 561-776-7757, 561-776-7757 to learn more. And Horizon Care Services, well, they are excellence in private duty home care, kind of in all areas. And that is all because of the wonderful person who started it, who founded it, who keeps it all rolling and just keeps on expanding and bringing the very best services together. And I'm talking about my friend Andrea Albertini, the owner, the founder. Well, when it comes to Horizon Care Services, she is that guiding light. And she's a great light to have here in the studio, too. Good morning, Andrea.
Good morning, Mike. Thanks again for having me on a Saturday morning. Very special.
Of course, it's always great to see you. Every show is special, but Horizon Care Services is a really special organization. And I mean, there are a lot of companies out there that do home care, but none of them can really be that same standard that you bring to the table, Andrea. And it's because for you, so much of this is a labor of love, I know.
Oh, absolutely. And actually, today I had a meeting with a long-term care insurance company.
Okay.
That was very interested in using Horizon Care Services because of our level of care.
Right.
And they were very, very impressed with our Nurse Navigator program, with all the things that we do to be able to maintain their client at home as long as they can.
Right.
And provide the best care at home. So they were very excited. And I was very excited to meet with them. So there was a great opportunity. Hopefully I'll have them in the show next time.
It's one of my favorite things about working with you is that we're having these conversations, we're talking about home care, what you bring to the table and all that. You always get this big smile on your face because it really does matter that much to you in your heart.
Absolutely. You know? I love it and I breathe it every day.
You do.
And you know what is a wonderful thing? I just put it on my social media, on my Facebook this morning and all of my social media. I'm just so honored and proud to be the owner of this amazing company with amazing employees, everyone is just 100% dedicated to care for our seniors. And it makes me so proud.
Well, if you look at your retention, I mean, look at the very beginnings of Horizon Care Services. Look at the employees that are still there.
Yes.
I mean, I think 60% of your caregivers have been there since day one, right?
Absolutely. And they're all in my wall and my conference room. There are pictures everywhere.
But I love it because it's for you. It is something where you truly do make a difference in the lives of your clients, in their families. I mean, caregivers often kind of fall through the cracks, and you support everybody involved. And you bring the very best people together to make sure that care is the best that it can possibly be, whether it's in-home, whether it's not. Horizon Care Services does it all. And once again, that website is horizoncareservices.com, horizoncareservices.com. And you've had some very interesting guests here on this program. I mean, all kinds of different programs and people. Some are in-home, some are not, but all of them certainly do provide the very best care. And today, you've got a very fascinating gentleman with us.
I know. I'm so excited for him to share.
It's very, very cool. We're talking about Dr. John Deluca, who is medical director for Palm Beach Integrative Medicine. And you can check out that website to learn more about what they offer. It's palmbeachintegrative.com, just like it sounds, palmbeachintegrative.com. Good morning, Dr. Deluca. How are you?
Good morning, Mike. It's great to be here. Good morning, Andrea.
Good morning,
Thank you for having me so much.
My pleasure. Thanks for being here.
Hey, it's great to have everybody together in one room. And let's talk a little bit, Dr. Deluca, about Palm Beach Integrative Medicine. What's it all about? What are your specialties? What do you bring to the table that's different than others? Because I look, and I mean, that's a very extensive curriculum vitae, and you've got the BTL Umsella program. There's an awful lot that you offer that most people do not. Let's talk about what the differences are.
So we take a very comprehensive approach in our practice in the care we give to the patients we treat. Mm-hmm. We don't just treat one thing. We're not a organ-based. Okay. We don't just treat one type of people. We treat all types of people. And how do we do that? Well, we use what's called, the approach is called integrative medicine. And so what does that mean? Well, Andrew Weil, the famous Dr. Andrew Weil, coined the term, and it's basically taking whatever best researched intervention or science and applied that to that particular patient.
Okay.
So what we do is we apply what we do to the patient and not the other way around.
But see, and you would think that that would be standard operating procedure because it's the most logical, but it's not. That's not how so many companies do business. They try to take what their product or service is, a lot of times the ones that pay them the most, and make them fit the patient, as opposed to looking at what the patient's needs are. And I think that's an admirable approach, Dr. Deluca.
Look, we're all different genetically, therefore we're all different biochemically.
Right.
And so we all have our different strengths and weaknesses based on our lifestyle, family history, medical history, what we do for a living, our social proclivities, as it were.
Sure.
And so what we do is we kind of look for the root cause analysis to that particular patient. What does that patient need? What are they lacking? What do they have too much of?
Right.
We try to balance the patient and then achieve good health that way versus trying to just suppress a symptom. I mean, sometimes we have to do that.
Well, sure.
If somebody has hypertension, if they come to my office with a blood pressure of 200 over 100, they're getting a beta blood. They're getting
let's do something to reduce that pressure.
Correct.
And then address the cause.
Exactly. That's exactly what we
Makes
do. So
sense.
then we look at their diet, their lifestyle. How do they sleep? How do they exercise? What do they put in their mouth? Right?
Wow.
All very important stuff.
I'm 50 years old and I'm sitting here trying to answer those questions for myself right now. And I think that, as we get older, a lot of those issues can come to the forefront just a bit more. Things that may have been out of balance younger, they've remained out of balance, and it gets worse as they get older. So when it comes to the senior community, integrative medicine certainly seems to me like it would be quite a boon.
It is. And we see most of our patients, they slant to the quote-unquote older side of the population because you can get away with a lot when you're in your 20s and your 30s and your 40s.
Does catch up, though,
But sooner or later, it will catch up to you.
Yes.
And then people come to us, and usually it's fatigue, they're tired, they don't have energy. So we look, biochemically, we look at, what a quote-unquote conventional doctor would look at, their CBC, their chemistry. But we go do a deeper dive. What's their vitamin D level? What are their hormone levels? Okay. What are their thyroid levels? What are we do different testing for nutritional analysis or toxin analysis.
Okay.
Nobody knows exactly what you've been exposed to all your life when you're just walking in the door. So
that's a good point.
We're not testing, we're guessing. But we don't want to guess. We want to test and then evaluate that particular patient and give them what they need or take out of their life what they don't really need.
Wow, I feel like I'm going to be stopping by Dr. Deluca's office soon.
I think we all should.
I was going to say, it's such a balanced approach to things, and I think that we're often missing balance.
Well, that's exactly right. We become so far out of balance in our lifestyles. We work too much. We don't take care of ourselves.
I know nothing about that.
Yeah, sure, Mike.
But really, I love that entire concept, and it's one that, once again, would seem to be pretty intuitive, but it's just not the case lately.
It makes sense to me, and that's why I practice that way.
Right.
So our patient base is very specialized. Everybody gets a different treatment. Everybody gets the same thing. It's not cookie cutter. It's not anything like that. And you have to get to know the patient. And so my typical, first visit is typically an hour with somebody.
Okay.
And just to drill down, what is their lifestyle like? And I drill down, what does your nutrition look like? Okay, let's talk about exercise.
Oh boy.
And
honesty is going to be key here, isn't it?
Well, it is.
Yeah.
And then we have the facility. We have exercise equipment in our facility. We have different things to bring, so we just say, go exercise. Or if you go, somebody says, well, just eat a proper diet. Well, I don't know what that is.
What does that mean?
Exactly.
That's going to be different for different people, too.
That's exactly right. Yeah. So we kind of give the people the tools to help themselves. And, I'm very fortunate that I'm allowed to practice this way.
I love it. The website, once again, is palmbeachintegrative.com, palmbeachintegrative.com. Now, taking a look at your history, it's very, very impressive as far as your education, as far as your licenses and certifications. And that tells me that you're very passionate about this. Why is that? Why are you so passionate, Dr. Deluca? Because clearly you are.
Yeah. So all started probably when I was in grammar school.
Okay.
I was never the smallest guy in the class, but I was always usually in the bottom 5.
Gotcha.
So, and then I discovered weight training in high school. Okay. And then we'll go, weight training? Well, proper nutrition.
Right.
And things have just sort of kept up with me.
What strikes me is that's very integrated.
Already.
Look at this. We've got this. We've got the weight training. How does nutrition fit into it? You started learning about that integrative approach when you were that young and really found a calling through it.
Exactly. I started out in pre-med in college.
Okay.
Didn't really like the curriculum, so I stumbled on a nutrition course, and that was like,
Food as medicine.
This
right?
is yes. It's
well,
like,
that's
this
Dr.
is,
Andrew Wow.
Exactly.
Yeah.
And this is for me. So I got my nutrition degree, and then stumbled onto the chiropractic. So I was in chiropractic practice for 10 years.
Okay.
Learned all about it's heavily nutrition weighted, all about the body, the biomechanics and things like that. Very important. It's totally overlooked in most conventional medicine,
Sure.
at least the primary care docs.
Right.
And then I was in practice for about 10 years, but I wanted to put more tools in my tool bag. So that's when I decided to go back to medical school. And then I studied internal medicine. Honestly, Mike, by that time, the toothpaste was already out of the tube. And I was already integrating medicine into my other practices that I was doing.
I love how that comes together. And, and you cover so many different areas. I'm looking at this. We've got the chiropractic is a part of it, as you'd mentioned. Nutrition's a big piece. Now, I am curious about one other thing, because I have this sheet of paper in front of me talking about something called BTL-MCELA. And I know that with the senior population in particular, although it's not limited just to seniors, it's most common with them. And we're talking about incontinence, which is, that's something that people don't like to discuss very often, but it is a very real issue.
But it also happened in young women as well, Michael, because sometimes
right.
you have people who has, triples, quadruples,
Sure.
children that, and they can be young. They can be,
post-pregnancy,
32.
you can lose that elasticity. There's all kinds of things that can change in the body.
So it doesn't necessarily mean for the elderly as
Sure.
you're aging. It's, any young women can get it.
It's a very fascinating thing. And I'm looking at this right now, and I see that there's a quote from Amanda who said, "I've regained my confidence because of my treatment and intend to resume my sport activities." And that's something that, younger and older alike. In this area, you get people that are seniors that are out there on the golf course, the tennis court, playing pickleball, especially these days, right? There's a lot of that kind of activity, and it seems to me, Dr. Deluca, that your treatments will allow people to, in certain cases, maintain that activity level, and that's an important part of integrative health.
Oh, yeah. So I do a lot of age management in my practice, hormone balancing and that sort of thing. And part and parcel of that, things that come along with age, one of them is incontinence or nocturia, having it up 2 and 3 and
Sure.
4 times during the night to urinate. So while hormone treatments help that a great deal, I found this very specialized biophysical treatment called the MCELA, and it's a chair that you sit in. It emits a high energy electromagnetic pulse.
Okay.
It's totally painless. There's no downside to it. You sit there for 28 minutes, and it's like doing 12,000 Kegel exercises.
I'm sorry, 12,000?
12,000
Kegel exercises?
Kegel exercises in 28 minutes.
I don't have the words for that. That's a very 12. Wow. And I imagine without the muscle soreness that would probably follow that. Huh?
Absolutely, yes. So 95% of the people who undertake this particular treatment, they tell us, they see improvement, and 73% report elimination of their symptoms.
Really?
Yes.
And I'm probably getting ahead of myself here, but I would imagine that might even have some effectiveness when it came to ED.
Absolutely. Erectile dysfunction, BPH, prostatic hyperplasia, hypertrophy, all help with that. So it helps men, it helps women. You increase area and energy to that area, you're going to see improvement in all your functions.
Hey, a better pelvic floor is going to deal with all that stuff.
Exactly.
That's a very powerful way to put it. And Andrea, I'm telling you, you continue to just find the most interesting people and the ones that are the most effective to bring under the umbrella of Horizon Care Services when it comes to helping people out.
Well, see, that's why we created this show, Mike, because so many people don't know what's out there for them.
Right.
And to be able to be, lucky enough to be able to have the radio show so we can share that with our community, that's amazing. And I was very impressed with Dr. Deluca when I met him a few years ago. And I said, I got to have you on the show and explain to people what you do and how you can help others.
Now, how does Dr. Deluca and Palm Beach Integrative Medicine fit into Horizon Care Services? How do you kind of work together with him to provide these services?
Well, one of the things that we'll do with them is, like I said, learning everything that he does. So if we do have a patient with those issues, that we can refer to him and say, hey, doc, we have a client that needs your services, and put them both together.
Okay.
So again, is us knowing what everyone does in the community to be able to be one step further and help our seniors or help anybody in need.
Sure.
And as Dr. Deluca may have patients who are aging in place.
Oh, yes.
And they don't want to go to a nursing home or assisted living. They just need some help at home. That's when we come in, where he'll call us and say, I have a client who may need your help. That sort of thing. So that's kind of how we work together.
It's an integrative approach that involves integrative medicine. I love how these things come together.
I have a philosophy: a hospital is no place for sick people.
That's such a good point.
So I'd like to see them get as much care as they can at home, which is very important because that's the best place to to recover, to heal.
100%.
And having good care at home is so important to that healing process.
Well, that's what Horizon certainly brings to the table as far as the very best in private duty home care.
Yes.
And that's why we have it. It's Limitless Health Horizons, and that's what Horizon Care Services is all about. Once again, horizoncareservices.com is the website to learn more about Horizon Care Services. 561-776-7757 is the number to call to learn more about it. When it comes to care in the home, Dr. Deluca, I know that there are a lot of reasons why it does seem to be the best place to do it. It's where people are comfortable. It's their space. It's their area. Let's talk a little bit about why that really is so important.
Well, I think COVID taught us a lot.
Okay.
We weren't coming out of our houses during COVID, but telemedicine, people were getting televisits, and it's important, to set up that proper healing environment at home to have the proper help there. I was just looking at a research project. They were actually having people exercise at home, not only for orthopedic rehab, but also for cardiovascular rehab. And this is going to be the field of the future. There's actually research behind this now, and that is where the puck is going, as we might have a hockey reference here.
Love it. Good. That's where the puck is headed.
Exactly. So that's where everything is moving to, and it becomes more and more important. Now, look, we need, I was being a little bit facetious, but not really, not a lot.
Sure. Well, look, you're not going to have an OR in your living room, but as far as having one at the hospital and then the best chances for recovery, the best chances for really convalescing would seem to me to be at the home.
Absolutely. Yeah. So having good quality care there, very important.
And again, Horizon Care Services brings it all together with the best caregivers too. And that's one of the cool things about this is looking again at Dr. Deluca's history and looking at the fact that when it comes to home care, you're bringing people into your house. We want to make sure that they are vetted, that their history is exactly what it should be. And I know that Andrea, that's certainly a big part of what you make sure is good when it comes to the people that you are willing to bring into your practice.
Absolutely. And we do select the best caregivers.
Right.
And we do put it back. We put a lot of money back into our caregivers, Michael, to do whatever we can to help them, because that's how our patients get the best care, because they are treated very, very well.
It's something that is so often overlooked. I mean, I was a financial advisor before I got into radio, and it was very much like, I can do this on my own. No, you can't. Yep. And the same is true of home care. And I think that people want to be, look, I'll take care of mom, I'll take care of dad. Well, it's not that simple.
Nope.
It never is. You may have work in New York or California, and your parent is here in Florida. They can't travel there, and you can't be here for them the way that you may want to. That's where Horizon Care Services comes in, and that's why you bring the best people together.
Yes, and I'm going to continue to do so, I hope, for another 20 years.
Well, it's certainly a powerful legacy so far. Now, Dr. Deluca, where do you see the future of integrative medicine? Do you think that it's going to continue to grow as a methodology? Where do you see it headed, and what would you like to see?
Well, I will tell you the future of medicine is integrative medicine.
Okay.
Because, we try to take the whole patient into consideration, and we're becoming better at it and people are actually seeking out our services because they don't want to be treated just like a number. They just don't want to be treated like the hypertensive patient.
Right.
Or, so they're looking for ways to take better care of themselves, to put more of the, patient-centered responsibility or, of the care back onto the patient themselves rather than, farming it out to a third party.
Sure.
So I think this is where where it's moving. We're just waiting for the rest of medicine to catch up. And I'll give you an example. When I first started testing vitamin D levels, nobody tested vitamin D levels.
Right.
It was like, I think $450 for have the test run.
Okay.
Now it's $50.
Okay, good.
As things become more popular and more used, prices go down.
Basic economics.
Very simple.
But another thing that's interesting to me here is that when you look at the integrative side of this, and I'm looking at things like chiropractic, I see chelation therapy and some things along those, the integration of Eastern and Western medicine as well, which used to be two completely separate entities. But I like to see those things come together and integrate. How does that tie into your practice?
Well, I did have medical acupuncture certification as I was going through medical school.
Okay.
So the East-West thing kind of opened up when Richard Nixon went to China in 1972.
Okay.
And that's where this whole, there's a whole other way of thinking about things.
Right.
And it's very, the Eastern part is very energy, based with
Sure.
the meridians for the, for the acupuncture points and the chakras from the Ayurvedic, type of
Sure.
things. So we're in this area of the world, we're just starting to learn how to integrate that,
right,
and how to use it in our practices. We do some herbal medicine, plant and herbal medicine, which would be considered, traditional Chinese medicine in our practice.
Sure.
Certainly, I'm not opposed to putting in acupuncture needles, when I have to.
Gotcha.
And it's just a matter of, just the art of my job or my practice is trying to figure out which is the best way to care for a patient, which modality we should use on that particular patient, at least what we should use first.
I love that concept, again, because it doesn't close any doors. You're keeping the door open to all these different modalities and how they apply to individual patients. And Andrea, I mean, you know better than anyone, after all your years of doing this, that no two patients are ever going to be alike. Everybody's going to need a different modality and a different set of people to help them. Now, you bring them all under one roof.
Absolutely. And I love how he does it. I love it. I mean, because you got to remember, it goes from the nutritionist to the chiropractic to being an MD. You know what I mean?
Oh, yeah, there's a progression.
It's absolutely amazing how he does it. So it's really cool.
It's the entire concept. Again, I love the integration of this because it's integrative medicine being integrated with all the other things that you bring to the table through Horizon Care Services. I've spoke with a lot of companies about things. I used to be a financial advisor, like I said. I certainly dealt with a lot. Never a company that has been as comprehensive as Horizon Care Services, Andrea. I've never seen one quite like it before.
Thank you. I like to bring information to the community. I think everyone should know what's available out there, and I do go around interviewing people and learning everything about everybody, and so I can bring it and share with everybody.
It's a phenomenal business model, and again, it's a pretty rare one. You can learn more again by visiting horizoncareservices.com, horizoncareservices.com, or calling 561-776-7757. Dr. Deluca, you mentioned, needles and, of course, acupuncture. One of the interesting things about that for me, and one of the things that made me a believer in it, was seeing video of people having surgery done without anesthesia, but using acupuncture needles to eliminate the pain and to work through that. Let's talk a bit about acupuncture itself, because I've had it done. I have loved a lot of it. How does that fit into your practice overall?
So acupuncture, I classify as an energy medicine.
Okay.
And we're moving energy around the body, qi, in the
which is measurable, by the way. It's something that I know it used to be. Yeah, it's this gossamer thing, but it's a measurable force that you can literally see and get metrics on.
You can. You can get metrics of the heart.
Yeah.
In the next room, you can measure the or the electromagnetic field of the heart, of the brain, and it goes out. So all medicine or all science is going to come down to the energy.
Right.
And then it's just how we apply the particular things. In my practice, we use the MCELL. That's pulse electromagnetic field energy.
Sure.
Acupuncture is qi, moving energy through the meridians. Or we might put people might be familiar with TENS units or muscle stim. That's energy going, from the outside in. Qi is energy from the inside out. So it's all energy medicine.
Quantum physics keeps pointing to this too. I didn't expect to get into a quantum physics discussion today here on Limitless Health Horizons, but it's kind of where it goes, because to me that's kind of where technology ultimately leads.
That's exactly what it is. It's quantum physics applied to the molecular or cellular biology level, and that's what everything is.
It's such a fascinating topic, but in the end, it comes down to better health, better services for the people who need them.
Exactly.
And I love it. Integrative Medicine, Palm Beach, integrative.com is the website to learn more about Dr. John Deluca's practice. And you will come into the home then? I mean, this is or do you typically do it more at the office? What's
we
that
did do it
situation
more
like?
at the office, but since COVID, about 60% of my patient visits are now virtual.
Virtual.
Yeah.
And it's wow, and that's another great part about how you adapt to the times, is that it's constantly shifting. Nothing is static, and as needs change, as people change, as we live longer and we're in better shape, but we need more help as we get older, Andrea. You've got to keep on adapting and changing the way you do your practice as well.
Well, every day. Every day we add it and we change it. Every day.
It's such a, I don't know, I love to see it happen. And that's one of the reasons this show is so exciting for me. Because, Andrea, you continue to expand and find the best services for everyone that could possibly need them. You don't leave many I's undotted or T's uncrossed.
I try not to, Michael.
Well, that's what makes it limitless, and that's what this program is all about. Limitless Health Horizons. And shockingly enough, we're pretty much out of time, which is amazing how quickly it goes. But that's just kind of how it happens on this, because we legitimately love what we're doing here.
Yes,
and I know
do.
that sets you apart so much from so many others.
And you know what? The fact that I can wake up every single morning and be happy in what I do, that's just the best feeling in the world, because I know that every day I'm helping somebody else. I'm helping another family. And as you know, it takes a leap of faith to call an agency and say, I'm in New York, my mom is in Jupiter, and I need help. So we are that company.
You are. I mean, we've talked to people who have been in that exact same situation, had them on this radio program.
Yes.
And, learned just how big a difference their services make in the lives of the people who need the care, in their families' lives. I mean, it's a ripple effect that goes way out all over the place, and you're the epicenter of it. And it makes a huge difference. Horizon Care Services, I mean, really, they are like the Citizen Kane of this. Is that reference dated now? Should I come up with a different movie to use outside of Citizen Kane? I don't know.
Whatever works for you, Michael.
But there you go. But Horizon Care Services really is excellence in private duty home care, and you keep on proving it. So this is Limitless Health Horizons. Learn more about Horizon Care Services by calling 561-776-7757 or checking out horizoncareservices.com. You can learn more about Dr. John Deluca and his practice by heading on over to palmbeachintegrative.com. Well, thank you all for being here, for the difference that you make. And Andrea, another home run, I'm telling you.
Thank you. Thank you very much, Dr. Deluca, for being here.
It was fun and a pleasure to be here.
Well, thank you for all you do. Thank you for all you do. And thank you for being a part of this radio program. This is Limitless Health Horizons, brought to you by Horizon Care Services. HorizonCareServices.com. Mike McGann, Andrea Albertini. We will see you again next week. Thank you, Dr. Deluca, for your time and what you do.
Have a great weekend, everybody.
That's it. Lots more legendary programming on the way. Stick around.
Horizon Care Services, because there's no place like home.